Hi guys, this is my presentation on different kinds of strokes and how TPA helps to alleviate the blood clots that cause strokes. For starters, I'm going to talk about the different kinds of strokes. So an ischemic stroke is the most common type of stroke that occurs when the brain's blood vessels become narrowed or blocked, causing severely reduced blood flow or ischemia. Fatty deposits built up in blood vessels can also cause blockages. Blockages can occur by blood clots or other debris traveling through the bloodstream and becoming lodged. These blood clots are caused by arrhythmia, heart attack, infection of the heart muscle, hardening of arteries, inflammation of blood vessels, and also a disease called arteriosclerosis, which narrows arteries over time, and this can also cause blood clots to form. There's also something called a mini stroke, which is a transient ischemic attack. They have similar symptoms but do not cause permanent damage as ischemic strokes do. A hemorrhagic stroke is the other type of stroke that can occur, and this happens when a blood vessel in your brain leaks or ruptures. There are many pre-existing conditions that can contribute to a hemorrhagic stroke, like uncontrolled high blood pressure, overtreatment with anticoagulants or blood thinners, aneurysms, trauma, such as a head injury from a car accident, protein deposits in blood vessel walls that lead to weakness in the vessel wall, or an ischemic stroke that leads to a hemorrhage if it's left untreated. A weakened vessel ruptures and bleeds into the surrounding brain, which causes the blood to accumulate and compress the surrounding brain tissue. And there are two different types of hemorrhagic strokes. They are intracerebral and subarachnoid. And I do have some pictures here to kind of show you what the different strokes look like. So the first one is going to be the ischemic stroke. Get my iPad here. So as you can see, the brain tissue, sorry, let me move over here. So the darker area that's showing in the brain is the tissue that is dying due to the blood flow being stopped by the clot, which you can see in the round picture over here. That darker area of blood is the clot that's blocking the blood flow, which is causing the brain tissue to not have any nutrients or any blood flow to it, so it's causing it to die. And then this is the hemorrhagic stroke. So you can see it's a little bit different. There isn't actually anything blocking the vein or the artery, but you can see that there is blood leaking into the brain tissue with this red area in the brain, and that is causing pressure to build up, which is causing the tissue to die as well. The way that strokes are treated is through TPA, which is a tissue plasminogen activator, and it is administered to patients through an IV, normally within 3 hours of a stroke. It dissolves the blood clots that are blocking blood flow to the brain. It's a serine protease, which is an enzyme that cleaves peptide bonds into proteins. The primary function is to catalyze the conversion of plasminogen to plasmin, which is the primary enzyme that aids in the dissolving of blood clots. And then I have a little summary of how TPA works. So it attaches to the fibrin on the clot surface in the brain. It activates the fibrin-bound plasminogen. The plasmin is subsequently cleaved from the plasminogen affiliated with the fibrin, and then the plasmin breaks up the molecules of fibrin, and this allows the clot to dissolve. And then there's another area in your body that activates so that the TPA is broken down and then released through the body, so that it doesn't stay. Plasminogen activator inhibitor 1 eventually terminates the catalytic activity of TPA by binding to it, and this inactive complex is removed from the circulation by the liver, more specifically by the scavenger receptor, LDL receptor-based protein. In the nervous system, our neuronal specific inhibitor of TPA, neuroserpin, acts similarly to PAI1, and the LRRP1 internalizes the inactive TPA neuroserpin complexes for removal from the circulation. And I have a little diagram of that as well to kind of show you, give you more of a visual. So we have the body over here with the TPA being administered intravenously, and then it travels through the body and goes to where the clot is in the brain, and you can see where it's binding there, and then breaking down the blood that has accumulated in the brain, whether it be in a clot or a bleed. And then the lower part down here is showing how it is broken down by the liver, and that way it can be removed from the body safely. Tpa is also a thrombolytic, and it's formed by an aggregation of activated platelets into fibrin meshes by activating plasminogen. More specifically, it cleaves the zymogen plasminogen as its ARG561 VAL562 peptide bond to form the serine protease plasmin. And plasmin is the enzyme that breaks down the cross-links between the fibrin molecules, which are the structural support for the blood clot. So that's another way that it breaks down the clot so that it can be removed from the body, so that that blood flow can be returned back to the brain. Its activity is short-lived, which is good, so that way it's not staying in the body and creating the blood to become too thin, which can also cause problems. And it's because the short duration is because alpha-2 antiplasmin, an abundant inhibitor of plasmin, quickly inactivates it and restricts the action of plasma to the vicinity of the clot. So like I said, it doesn't let it travel to other parts of the body. It stops it in the area that it's needed, and then it's broken down and released from the body. So I hope you guys enjoyed my presentation and the visuals that I provided, and I hope this kind of gives you a better idea of how both strokes occur in the body, and how a TPA is used in order to break down the clots or stop the bleeding, so that way people can return back to their normal function. Thank you.